within the next 4 weeks, rainy season is going to start in Malawi. I'm already panicking to say what is going to happen. God forbid there's another cyclone which hits us in Malawi. What are we going to do? I'm in a panic mode as it is now. So we're saying we should not be in a panic mode. We need to do something. So we are here in Dubai for COP28 because for the first time they've introduced Health Day at COP. This is COP number 28. It means there have been subsequent meetings prior to this one. But this one is very important to us because of the health component of the whole thing. What we are saying basically is that over the period, the health sector has been on the receiving end. So many issues have happened due to climate change. We have had cyclones globally. In Malawi, we have been having cyclones like every year for the last 5 years. And the worst cyclone hit us this year in March, which displaced over 2 million people. We had about 2,000 injured. We had about 600 dead, and then 500 something still missing up to now. It caused so much devastation. We lost crops, people lost houses, clothes, livelihood, and in the health sector, infrastructure, we had most of our facilities damaged. Up to now, they have not yet been, rehabilitated or maintained so that we can start giving service. We lost equipment, we lost fridges, which we keep for things like our vaccine. So it has really set us so much back, which is very, very unfortunate. And then you can also tell the pattern of the diseases, things like malaria. We had made so much progress on the management of malaria as a country, but because of also our partnership with our partners like Global Fund, they're big. We work together in terms of malaria, tuberculosis, as well as HIV and AIDS management. So we had done so much, in terms of malaria, but now we have been set back, because of issues of climate change. And then issues of cholera. We thought we had done with it, but from last year, from nowhere, we had cholera. It's still there now. A whole year cholera. Normally cholera, you'd have 1 or 2 cases during the rainy season because of the damage to sanitation and hygiene facilities. But this time around, it was affected all the districts, even in towns, even the rural areas, from January to December, which has never happened before. So these are the issues which really you can tell that these things are happening because of the issues of climate change. And then you talk of issues of pneumonia, things like those because of the quality of the air. But also we talk about carbon emission as well. There are so many different cancers which are affecting our people, skin cancers which are affecting our people. So there are so many issues, and of course, not just cyclones, you have droughts as well. Droughts, it means it affects our crops. This will lead to malnutrition as well. You see? So there are many things which are happening, which are effects of climate, but we are on the receiving end because now we have to do something about the people who are sick. We have to provide the services, extra services, So we are saying, we need to be a part of this conversation, of this discussion, so that together with our colleagues, because most of the times you find in most countries, including Malawi, it was only the minister responsible for environment and climate change who was involved. Me as a minister of health were not involved. Most ministers of health were not involved in the discussion about climate change in our countries. So we're saying, no, that has to change. We have to be a part of the discussion because we also have our own idea on how we can, work together so that, we can be able to provide the services. We need, if there's funding or whatever, we also need to benefit from the same so that we address the issues which have happened because of the impact of climate change. As Malawi, we have come up with our own declaration on the issues of climate change and health, but also as member states of African Union, as Africa, we have also come up with a common position. Because what is happening in Malawi, obviously, is the same is happening in Zambia, Zimbabwe, and Mozambique. All the issues I've talked about, the cholera issues, the malaria issues, they're affecting all of us as a bloc as well. So we have come up with a common position, which, as a country, Malawi, we have also endorsed. We cannot afford at this point in time to operate in isolation. We need all of us to have the same objective on what is it that we have to do in the health sector so that we mitigate the effects of issues of climate change and the climate shocks. This conference gives us a platform, an opportunity, because we are going to meet so many people, the partners who work with, those who are responsible for funding. It is unfortunate that the discussion we are talking about, it should have happened yesterday or the day before yesterday, even last week or last year. So there are things which we have to address, but which have already, the broken systems, which have already broken, but we have to repair them before we even start talking about now, before we even start talking about the future.